Welcome to the MamasteFit YouTube channel. In this workout, we're going to be targeting this left posterior pocket of the pelvic floor that can sometimes have some overactivity and may be contributing towards tailbone pain, left SI joint pain, maybe just kind of general discomfort or sciatic pain towards the back. And so if you're dealing with any of that discomfort, we're going to resolve that with this workout today. Hey, my name is Gina. I'm a perinatal fitness trainer and mom of 4, and I have a pelvic floor just like you do. And I have dealt with some discomfort in the back half of my pelvic floor that could be related to that left posterior pocket. And so if you've been dealing with tailbone pain, which if you didn't know, your tailbone attaches to all of the pelvic floor musculature. If you've been dealing with left SI joint pain, maybe constipation or back pelvic pain, sciatic pain, in this workout, we're going to be doing some exercises to help to improve pelvic mobility, to improve the strength of the surrounding musculature so that your pelvic floor can let go and stop contributing towards this discomfort that you're feeling. If you've watched our other videos, you're going to be familiar with this concept, but all of the pelvic floor musculature attaches to the pelvis. So different kind of hip positions when I walk, when I run, when I exercise is going to change the tension within the pelvic floor. So your entire pelvic floor is not tight, your entire pelvic floor is not loose, and there's no one movement that's going to stretch or strengthen the entire pelvic floor all at once. We need a variety of different types of hip positions and different types of pelvic positions to stretch and to target each portion of the pelvic floor. Many of us, because we stance more on the right side, so we like to favor our weight towards the right leg. The diaphragm is larger on this side, the organs are denser on this side, and so we just feel more stable on the right side of the body. However, when it comes to then shifting our weight over towards our left, sometimes the pelvic position does not change to accommodate for that weight shift. And it could be that that left posterior portion of the pelvic floor is just very tight and holding on and not allowing us to shift properly into that hip. And so when we have a hard time shifting our weight over towards the left, this can cause some discomfort in that left SI joint pain. If that left posterior pocket is really tight, it can actually pull the tailbone towards the left, causing some discomfort. And then it can also compress kind of the nerves in that back part of the pelvis, which can contribute towards more of that sciatic or piriformis-type pain. And so in this workout, we're going to be focusing on shifting well into the left hip to release some of that tension. And we're also going to be incorporating some exercises that help to coordinate that shift over to the left side as well. And so for this workout, we're going to need 1 yoga block. We're going to need 2 medium-ish weights for you. We're also going to need a long resistance band that's attached around chest to eye level. And so if you don't have a band, I'll show you a variation to do it without an attachment point, but you will need a long resistance band. We're going to start the workout on the floor with some floor-based exercises, and then we're going to progress towards some standing movements because we tend to live our lives on our feet, and so we have to progress from the floor to upright if we want to see relief from discomforts that we're having. So once you've got your equipment, let's go ahead and get started with our floor-based exercises. So we're going to start in an all-fours hip shift. So I'm going to place the yoga block down on the floor, and then I'm going to place my left knee onto that block. From here, I'm going to shift my weight over towards that left knee. So 80 to 90% of my weight is over towards this left side. If we looked at the angle between my femur and my pelvis, it would be less than 90 degrees here. From here, I'm also then going to find a slight round in my back because a rounded position makes internal rotation a little bit easier. And so I'm thinking shift my weight over towards the left. We're trying to feel kind of a stretch here in this hip pocket. If you're not really feeling much, which is common in this position, you can get really close to a wall. And then you're going to drive that right knee into the wall, which is going to activate the right glute and kind of push you a little bit deeper into that left side. And so that can sometimes help if you're not near a wall. You can also Like you can almost think like you're trying to press into that right knee, like kind of like the inner side, which is gonna help to activate that glute a little bit more. So we're thinking about, can I activate this right glute, which is going to bring this hip more open and drive you a little bit deeper into this left side. But know that it's okay if you're like kind of not feeling much in this position. It's not uncommon. Now keep that position and we're gonna move through some pelvic tilts. So we're gonna find an arch in the back and then exhale to pull belly to spine to find that round. So inhales to lower down and then exhales to round in the back. And when we come to the round, we want to think exhale, pull belly to spine. It's that core activation and contraction that's bringing rib cage and pelvis closer together. So what I don't want you to do is like clench your glute or like squeeze your butt to help with the round. I want you to think exhale, it's my core activating that's bringing me into that rounded position. And you can almost think like you're thinking more of that left external oblique is kind of crunching you more to that side as well. And so now we're gonna grab on to our 2 weights that we had, and we're gonna do a little bit of a posterior oblique sling exercise. And so with left SI joint issues, we wanna think about, how do I coordinate movement across the SI joint? And so you're gonna hold both the weights, or you can just hold one and put one hand onto a yoga block. And we're gonna think exhale to drive your right foot towards the ceiling as you row the left arm back. So we're going to exhale, keep rib cage and pelvis together as that foot lifts, and then row the opposite arm. So left arm is rowing, right foot is driving towards the ceiling. And then I want you to pay attention as you extend that foot. Are you beginning to really arch in the back? We really want rib cage and pelvis to stay closer. So if you extend and you cannot avoid extending in your body, I want you to think, just kind of bring that foot back and then back in. And then as you begin to be like, okay, I think I got it, maybe you lift the foot a little. But we do want to avoid arching in the back because we want that core engagement to be working to keep us in our position. And let's switch to the other side. So left foot drives to the ceiling, right arm is rowing. And again, we want to avoid arching in the back. So rib cage and pelvis are pulling together as you extend. You're going to feel it so much more in your glute if you avoid arching. If you arch, we're not going to have that same glute activation, and this exercise is essentially not doing anything for you. If you cannot kick back without arching, extend the leg and think toe to the floor as you row. And then eventually you can just lift the foot off the floor just a little bit. And then eventually progressing again back towards that bent knee. Go ahead and put those weights to the side, and we're gonna move on to our inner thigh strengthening exercise. So we're gonna come into a 90-90 position with right leg in front, left leg behind, and I'm gonna place that yoga block underneath that left knee. And so now we're gonna be thinking about a left inner thigh strengthening exercise. So come onto that forearm, and then we're going to drive through that left knee to lift the hips off the floor. So most of the effort is in that inner thigh. And then left or right knee can just kind of pulse. So we did a hip shift to help kind of stretch and release and offload that left posterior pocket that tends to be a little bit tighter based on how we commonly stand with the left side. We tend to favor a more open hip position on the left side. And so now we're going to be thinking about strengthening the left anterior portion or the left front half of the pelvic floor that tends to have a little bit more length. And inner thigh strengthening exercises and hamstring strengthening exercises help to pull the pelvis more internally rotated, which is essentially the opposite of what the left side likes to be in. And so if we're stuck in this open hip position, it makes it much harder to stabilize, which is what can cause some of that left SI joint pain. So now we're going to come to a standing position to do our other movements. So now we did the floor-based exercises. We'll release the posterior pelvic floor with some pelvic mobility, and then we moved into some strengthening exercises to help pull us into a more closed hip position on the left, in addition to strengthening that posterior oblique sling, so lat to opposite glute, to help coordinate movement across that left SI joint area. So now we're going to do similar movements, but now in a standing position. And so we're going to start with that standing hip shift. So if you didn't really feel it a whole ton on the floor, you'll probably feel it more in a standing position. So we're going to place that left foot onto the yoga block. So most of the weight is on that left side. And I'm going to reach my arms in front and then open up to the left without that left knee flailing out. We're going to hinge at the waist. So if a flashlight was attached to my butt, shining the wall behind me, not the floor below me. I'm going to think lots of weight in my left foot, put a lot of weight in my left big toe, left knee is kind of rotating in, and then I'm thinking right hip and left knee are trying to touch one another. So those 2 points are coming together, and you're going to feel more of a stretch in that left kind of hip pocket area. Find like a slight tuck underneath, and then again, most of the weight is in that left hip. From here, I'm going to reach towards my left foot, keeping that left knee in, lots of weight in that left big toe. And so if you're feeling it a ton in the hamstring, that leg may be super straight. I want you to just bend in it slightly. So we've got about 10 more seconds in this static hold, and then we're going to move to the floor and do some alternating from leg to leg. So go ahead and place that yoga block to the side. Feet are going to be even. I'm going to find my left hip shift. So right knee drives forward. I'm putting more weight into my left foot. I'm going to come to a standing position and then shift over to the right, where that left knee drives forward and more weight is in my right foot. And then alternate from side to side. One of the things that can contribute towards pelvic pain is the inability to shift our weight towards one leg or the other. And so it may be easy for you to shift into the right. It may be awkward to shift into the right or into the left, but we're just going to do some mobility where we're moving from leg to leg. So when I hip shift, that hip finds a more closed hip position, and then my opposite hip finds a more closed hip position. And a closed hip position is how we stabilize in stance. So now we're going to do that posterior oblique sling exercise. So I'm going to grab on to my long band. If you don't have a long band without an attachment, you're just going to hold on onto your hand, and then your opposite hand is going to be your anchor point. So I have my attachment point, or you're using your opposite hand as an attachment point. I'm going to put weight into one foot, and then the opposite foot is going to step back. So this forward leg is going to be my stance leg. So with our posterior oblique sling exercises, these are going to help to stabilize across the SI joints. We have opposite sides working together. So my right lat and my left glute are going to be working with one another to help stabilize and compress across to the SI joint. And so at the bottom, I'm going to find length. So stretch in my lat, strengthen, stretch in my glute. And at the top, I'm going to find shortening in both. So I'm going to think inhale to hinge forward as I reach, so lengthen my lat, lengthen my glute, and then exhale to row as I extend in the hip. So inhales to reach forward, exhales to row back. So find length at the bottom, and then both sides are contracting at the top. And now I'm focusing more on a hinge as I lower to have a little bit more hamstring. If you want to do a little bit more of like a lunge, that's also a posterior oblique sling exercise. But let's focus a little bit more on that hinge because the hamstring is what's going to help to pull that pelvis more internally rotated. And eventually you can progress this to doing more of like a single leg deadlift as well, but the stagger stance is going to give you just a little bit more support. Let's switch sides. So right foot is down, left hand has the band. So finding more of the hinge where we have length at the bottom of the glute, length in the bottom at the lat, and then exhale to shorten. So extending the hip and rowing at the same time. With these posterior oblique sling exercises, it's a part of our myofascial sling chain. And with those exercises, we want that simultaneous activation on both ends of the sling. When we have that, it's going to be compressing to help stabilize on those pelvic joints, which is a major junction point from our upper to lower body. Go ahead and release the band, and now we're gonna finish up with a hamstring strengthening exercise with the single leg deadlift. So I'm gonna hold on to my weight, and I'm gonna hold it in the right hand for both sides. I'm gonna put weight into my left foot, and I'm gonna use a wall for support, but you could do it away from the wall. So this weight is in the opposite hand. So right hand, left foot is going to be my stable foot. And then inhales to lower down, exhales to stand up. As I lower down, I'm gonna think about my hips staying more square or dropping my right hip down for more internal rotation. And then exhale to stand up. So inhales, you can find more of a closed hip at the bottom, or you can focus a little bit more neutral. But the opposite hand is gonna help to emphasize more of that closed hip position, which for the left leg is what we want a little bit more of. Hamstrings again, work with the adductors or your inner thighs to help pull that hip into a more closed hip position, which if we're thinking about improving left hip mobility, improving left SI joint discomfort, we want to improve that mobility of the back half of the pelvis. So now keep the weight in that right hand, and now we're gonna do the right foot at the bottom. We're gonna find more of an open hip position and then stand up. So you can almost think like left knee reaches up. So for that right leg, we tend to favor more of that internal rotation. So if we can emphasize more of the glute strengthening, this is gonna encourage us to spend a little bit more time on that left side. So same side holds is going to emphasize more external rotation. Opposite side is going to emphasize more internal rotation. So we're doing the same movement on both sides with just a slight variation to help support pelvic balance. And this concludes today's pelvic stability workout. In this workout, we did some mobility exercises to help release the back half of the pelvic floor, which for a lot of us, the left side tends to hold a little bit more tension than the opposite side. And so we were focusing on those left-sided hip shifts to release and to offload that posterior pelvic floor. We also incorporated pelvic mobility to improve how well the pelvis changes position in these non-loaded positions. So we did our pelvic tilts from an all fours position and the standing alternating hip shift just to play around with the movement of the pelvis to find that internal to external rotation. We then did some posterior oblique sling strengthening exercises to help improve the force distribution across the SI joint during movement. So we had our lat strengthening exercise with the opposing glute strengthening exercises to help compress across the SI joint for stability with our bent knee kickback and row and our stagger stance RDL and banded row. We then finished up with some inner thigh or some hamstring strengthening exercises because the inner thigh and the hamstrings help to pull the pelvis into internal rotation. And so on the left side, the inner thigh and the hamstring tend to be a little bit weaker compared to the right. So overemphasizing them on the left side can help to improve your ability to change positions, which sometimes that is what's causing that pelvic pain on the left side. And so incorporating exercises that help to improve pelvic mobility, that help to incorporate the myofascial slings, and to address uneven strength and balance within the pelvis and the surrounding musculature can really help to improve discomfort from tailbone pain, left SI joint pain, sciatic pain. And so we like to incorporate a lot of movements like these within our prenatal programs, our postpartum programs, and our beyond postpartum programs so that you can feel good in your body at any point. Pain is not a requirement of pregnancy. It is not a requirement of being a mom, and we would love to help you feel pain-free and good in your body throughout your entire motherhood journey. You can check out all of our fitness programs on our website at mamastefit.com/fitness-programs and use our code YouTube10 to get 10% off any of our online offerings. And so let me know down in the comments below, how did this workout feel for you? Were there any exercises that felt more awkward for you? Do you feel better after doing this workout? And then let me know what other issues that you've been dealing with so I can do a workout video to help you feel good in your body today.